Today's question: how do I choose the healthcare insurance plan that's right for me? The simple answer is, to make the right decision, you need to ask yourself the right questions to assess your needs. Ready? Then take a good look at yourself and let's get started. First, do you want basic coverage or more comprehensive coverage? Basic plans are designed to protect your finances in the event of a major illness or injury. They have higher deductibles, that's why monthly premiums are lower. Let's say our friend Gary, who is usually very healthy, has an unfortunate experience while ballooning over the Alps. His basic plan would help by covering most of the major medical expenses he incurs. Other plans start paying sooner because they have lower deductibles, but monthly premiums are higher. They're a good choice for people who expect to seek medical care more often. How much can you spend? Balancing cost and coverage is the key. Find out the plan's deductibles, co-pays, co-insurance percentages, and the maximum out-of-pocket you'd have to pay for the year. Know what your money is buying. Are you single or married? Do you have children? Picking the right health insurance is a lot like buying a car. Is a two-seater all you need, or will a van be a better choice on the road of life? Does anyone who will be covered need prescription medication frequently? If so, prescriptions are important to consider in making your plan choice. Is your doctor part of the plan? To get the highest level of benefits and save the most money, you need to use doctors and facilities that are part of the plan's network. So be like Gary. Check the plan's provider directory to see if your preferred doctors and hospitals are in it. Do you want easy access to specialists? For example, Gary has back problems. He chose a plan that allows him to go to the specialist Uncle George swears by. You may prefer a different type of plan where you work with your doctor to get all the care you need, including specialists. It's your choice. Do you have other specific needs? Maybe you're on the road a lot. If so, you might want a plan that will cover you whether you're in New York or New Mexico. Or maybe you need coverage for mental health or nursing care. Now's the time to think about it. Also consider that financial assistance is available to those in certain income ranges to pay for healthcare costs and insurance. How can you find out more? Attend employee meetings about your plan. Talk to an agent. Go to seminars that are offered. And use the insurance company's website as a resource. To sum it up, to choose the plan that's right for you, ask yourself the questions that will help you assess your needs. Think about the ways you use healthcare, the medical needs you can foresee, and how you can balance cost and coverage. So now you know. Until next time, stay smart and stay healthy.
When it comes to your health, it's always good to have all the facts. So let us take a moment to look at the main differences between public and private healthcare in Australia. Public healthcare, which includes Medicare, is provided to all Australians and permanent residents. The public system provides affordable, accessible and high-quality healthcare by providing cover for medical services, such as doctors and specialists consultations, admission to public hospitals, and also subsidises some drugs under the Pharmaceutical Benefits Scheme. If you go to a public hospital as a public patient, you'll be treated free of charge by a doctor appointed by the hospital. However, depending on the treatment you need, you may have to join a waiting list. If you want to avoid public hospital waiting lists, choose your own doctor, be treated at a private hospital, or be covered for additional types of out-of-hospital treatment, you can either pay for this yourself or take out private health insurance. So why do people choose private health insurance? Private health insurance gives you more choices when it comes to your hospital treatment. To start off with, you can choose from a wider range of hospitals. You can choose the doctor you want. You can usually choose when you go to hospital for your procedure. And you can get cover for out-of-hospital extras, such as ambulance, dental care, optical, physiotherapy and other services not covered in the public system. While private health insurance gives you more options for your health care, it also means there may be some extra costs you need to pay yourself. Unlike the public system, you may be charged a gap fee for your doctor's services. If you're scheduled for an admission to hospital, always ask your doctor for more information about their fees. If you're being treated for a condition which isn't fully covered on your policy, You may also have to pay for some or all of your hospital theatre and accommodation fees. If you're planning a hospital admission, always ask your health fund and the hospital about any potential expenses you may have to pay. Finally, if you need to use your hospital cover, your policy may have an excess or co-payment. An excess or co-payment is an amount you agree to pay towards the cost of hospital treatment in exchange for lower premiums. So in a nutshell, private health insurance gives you more choices with your healthcare and can help pay for the things that the public system doesn't. If you want to start looking into private health insurance, you can start by using our website privatehealth.gov.au. Use the Compare Policies tool and the standard information statements to find and compare any health insurance policy in Australia. And if you need more information about private health insurance, just call us or check out the website.